Right, and to unpack this for us, we are now joined by a Limpopo Health MEC, Dr. Phophi Ramathuba, and she joins us via our Zoom link. MEC, thank you so much for joining us here on the late edition. When it comes to the issue of malaria that has indeed plagued your province, how concerned are you about these reports coming out from Limpopo?
Good evening, Mbali, and evening to all your viewers out there, and thank you for inviting us. Yes, we are concerned because malaria, as we have always reiterated, while it can be prevented and it can be cured, the reality is that malaria can kill, and we still continue to see people dying of malaria. And that is very painful because for us, we know a lot can be done to prevent death out of malaria. So what we saw happening with the current, what we refer to as an upsurge or a spike in cases, was that towards the end of April, I think the week of the 23rd, our facility started to report an increase in number of patients presenting and testing positive for malaria, especially if you look at hospitals like Donald Fraser in Wembe and Malamulele. These are in Wembe. And in Mopani district, Maputa Malachi Kensan, and also Litawa Hospital. And when we look, these areas have always been a malaria endemic area. And this time around, when we try to do an analysis, what could have happened, we realized there are two possibilities. One, these cases, we started to see them 2 to 3 weeks after the Easter holidays. And most of our migrant workers who reside outside the area, the possibilities that when they went home for Easter holidays, they could have been bitten by mosquitoes which were carrying those parasites, and they came back carrying the parasites in their system. And the local mosquitoes, which are also carry malaria, after biting them, took that parasite to the next person. So that's how we think it could have happened. The second scenario is the fact that while ordinarily in the past years, towards the end of April and May, we start to record 0 cases of malaria because we are facing winter season, and malaria do not really thrive during the winter season. But due to climate change and what we see happening is that it's not necessarily, we can't say it's winter, we can't say it's summer, it's raining, it's hot, it's cold, it's all seasons in one day. That's what we see happening even in Limpopo. So there's a possibility that because those who warned us about climate change raised the question that you might find the disease pattern also starting to change because we can't even predict the weather these days.
And MEC, how would you say as a department you are actually responding to this upsurge of these cases? Do you have the capacity to actually deal with these malaria cases in the province?
I think we do have the capacity. What is required is that we need the support from the community themselves. As we always say as a department, that our health is our responsibilities first as individuals. Now, usually on an annual basis from August, we appoint a malaria seasonal sprayers. This financial year, we increased the number from 400 to even 600. From August, September, we started indoor residual spraying, which is a program that has been seen to be effective over a number of years. There was a year where we recorded over 18,000 cases and 160 deaths. But we managed, like in the past year, financial year, we only recorded just over 1,700 cases. So that indoor residual spraying where we do spraying does work. So even now, we also believe that there is a possibility because the two chemicals that we use, the KO3 and the DDT, unfortunately the KO3 can only last from around 6 to 7 months, whereas the DDT can only last 10 up to 12 months. So those households that we started spraying around September, August, there's a possibility that the chemical has now a way of its efficacy. So we need to do the second round, because this time around, as I've indicated earlier, usually it's no longer a malaria season. So with that, we will continue now to focus on those areas where cases are being detected. Our teams responded. And you can see that from this week, the numbers have gone down drastically. We saw more than 75% decrease in terms of new malaria cases that were confirmed both in the clinics and in our hospitals. Just to give you an example, yesterday, Donald Fraser recorded around 2 cases, whereas if you look at what happened in the past week, they were recording on a daily basis from around 12 patients being admitted. The same goes to Kansani. This morning when we checked this afternoon, no case was recorded in Kansani, and by midday in Donald Fraser, we had not recorded any single case. So you can see that the cases are now going down, because that peak, based on the theory that I've indicated earlier on, could be possible that as a result of the Easter holidays, that is why we saw that spike. Because the outbreak, you should remember that it's not only within the Limpopo province. We have seen other parts of this country, parts of Mpumalanga and parts of KZN, which are also historically a malaria endemic. We have seen SADC region also recording a spike in terms of malaria cases. So this could have been the possibility of what we see happening. But secondly, we're also saying, while as government we are spraying, we expect the community to support us, firstly, by agreeing to our sprayers when they come to their household to do the spraying. Up to so far, we'd already sprayed more than 1.2 million household units. So the second way is for individuals to protect themselves, because malaria is caused by mosquito bite. If you avoid to be bitten by the mosquito, you will not get malaria. And we must also remember, not every single mosquito can transmit malaria. You've got the female Anopheles mosquito, which is responsible for malaria.
And MEC, coming specifically to your program, where you are saying that you've already sprayed more than 1 million residents living in the Limpopo province, you know, that specific program, how will it look like? Because you are saying that because now malaria is not a case that's only being dealt with in summer because of climate change, it now needs to be extended. When you plan as a province, what will that program look like, and how much are you planning on spending, and do you have the capacity and the amount of money to actually deal with a program of that magnitude?
We do have the capacity to in terms of resources. Firstly, I've already indicated that in the past we used to appoint 400 malaria sprayers, seasonal sprayers. Now we have increased the number to 600. We increased by 200 more. In terms of the chemical, malaria, because South Africa has also declared that we are looking towards a zero malaria, which begins with me and you. That means we've put in a grant that is specifically there to deal with malaria. So this is a grant that must make sure it's ring-fenced. There's no way that if I'm running short of medication for TB, I can use the malaria grant to buy TB medication. So that's why I'm saying it is a grant, a conditional grant that is meant, which we receive from national. The National Treasury and National Department of Health do have contracts that we procure from those national contracts, both the chemicals, the KO3 and the DDT. Also, at the same time, all our clinics have got the malaria test kits. That you be rest assured. When I said malaria can easily be treatable, if you experience a headache, fever-like symptoms, like you've got flu, your body's chill, aching. In some severe cases, people can even vomit and have diarrhea. But when you start with your headache and fever-like symptoms or flu-like symptoms, do not rush to the chemist and self-medicate and think by drinking med lemon, because if it's malaria, it can progress and kill you. By rushing to your nearest clinic, you will get the test kit and you will be tested. You'll be given an oral tablet and malaria can be cured.
All right, then. Thank you very much, MEC. That is the MEC for Health there, Dr. Phophi Ramathuba. Also giving advice to those living in Limpopo, saying that do not treat those flu-like symptoms on your own. Do indeed visit one of the healthcare facilities and get tested for malaria.